Hi everybody, welcome to this episode of Optimal Healthcast, aka as the Health for Health Matter. This health talk show will educate you on all you need to know about health and health-related illness. I'm the host, Akamla Lilian Chinaza, and here with me are
Romanus Amarachi Merit.
Unable confidence. Okay, princess.
That is easy.
Thank you everybody and welcome. Today we'll be discussing on HIV and AIDS because today is World AIDS Day. Yes, today is World AIDS Day and this is an annual event that is being done to create awareness, support, and to commemorate those who have died from this illness. This is a program that is being done every 1st December of every year. It's an official global campaign that is being marked by World Health Organization, that's WHO. According to the latest data from UNEP, that's United Nations Program in HIV and AIDS, have shown that 39.9 million of people have been affected with this illness and 630,000 people have died from this HIV-related disease. And so today, me and my colleague will be discussing on this HIV and AIDS and everything about HIV and AIDS. So sit and enjoy the show. So Nurse Merit, can you help me and enlighten the general populace on the definition and causes of this HIV and AIDS?
Okay, thank you so much. HIV and AIDS stands for Human Immune Deficiency Virus. This is a virus that attacks the immunity of an individual. AIDS stands for Acquired Immune Deficiency Syndrome, and AIDS occurs due to the HIV infection reaching its advanced stage. What I mean by this is that the viral load of this HIV increase or get to its severe state. HIV targets the white blood cell on the person's body, thereby weakening the immune system. This makes the person get sick of diseases like tuberculosis, different infection, and some cancers. Note that you cannot get this HIV by kissing or hugging a person or by sharing food with a person, but it can be spread through the body fluid, which includes 1, blood, 2, the semen from the male, the breast milk, and the vaginal fluid. Note again, the mother can transmit this HIV virus to her baby in utero if proper care is not taken. Thank you so much.
Thank you so much, Nurse Merit, for that wonderful explanation on the definition and causes of HIV and AIDS. So, Nurse Doris, can you help with the signs and symptoms of this HIV and AIDS?
Okay, signs and symptoms of HIV and AIDS the widespread of it starts immediately the individual is being infected. But then most abundantly, the first few months that the spread is more severe, ranging from fever, headache, sore throats, as well as rashes on the individual skin. This is what you notice at the first stage of the encounter. After this stage now, this disease starts suppressing the immune system. Then you start noticing signs and symptoms like swollen lymph node, cough, diarrhea, and weight loss, as well as fever. Thank you.
Thank you so much, Nurse Doris, for that detailed explanation on the signs and symptoms of this HIV and AIDS. So, Nurse Confidence, can you help with the risk factor of this HIV and AIDS?
Thank you so much. Like my colleague previously said, we don't have a main cause that we can say this is what caused this HIV, but we have some attitude that can predispose someone to HIV positive. And some of those factors are like exchange of fluid, just like my colleague previously said. She made mention of blood, breast milk, and this is when the blood is already contaminated. Okay, during a blood transfusion, when it's not properly screened to know if the person is HIV positive or not, if it's been transfused to another person, the person can get HIV positive, can be predisposed to that. And that thing is unprotected sex. Unprotected sex can predispose someone to HIV positive. Infected needles, as well as some procedures that is being done in the hospital, which are done with unsterilized equipment. So these are some of the things that can predispose someone to HIV AIDS.
Thank you so much, Nurse Confidence, for that detailed explanation on the risk factor of HIV and AIDS. So, Nurse B, can you help with the preventive measure of this HIV and AIDS?
Okay, thank you very much. Now, I'm going to talk about the preventive measures of HIV and AIDS. Number one is every individual should get tested for HIV and AIDS. The reason I say so is that when you get tested for the HIV and AIDS, you get to know your status. If you're negative, fine. Then if you're positive, you go to hospital or health facility where you can access the drugs and be placed on antiretroviral therapy. Then another thing is an individual should limit the rate of unprotected sexual intercourse, because limiting the rate of unprotected sexual intercourse will make one not to be exposed to the HIV and AIDS virus. Then the rate of some acts of sexualities like anal sex, oral sex should be reduced, because when it is reduced, it will limit the individual being exposed to HIV and AIDS. Then anyone that wants to have sex with anybody whose status is unknown should make use of condom, maybe female or male condom. Then lastly, in case if one was engaged in rape and the person did not know, of course, when somebody is raped, there is no way you will know the health status of that person. The person should go to the hospital where there is heart-to-heart center and be placed on post-exposure prophylaxis, which is also known as PrEP, because this post-exposure prophylaxis will help the person not to get HIV and AIDS in case if the person that raped the individual is tested positive to HIV virus. Thank you very much.
Thank you so much, Nurse Blessing, for that wonderful explanation on the preventive measure of this HIV and AIDS. Okay, Nurse Princess, can you help with the treatment of this HIV and AIDS?
Thank you. As we all know, HIV and AIDS has no cure, but can be treated. Come close. I know you might be wondering what I mean by HIV cannot be cured, but can be treated. We have this medication called ARTS. What do I mean by ARTS? It means antiretroviral therapy. What does this antiretroviral therapy does to you as someone who has been tested positive? It simply suppresses the disease, which is the HIV, and boost your immune system to be able to fight against other diseases such as hepatitis B, syphilis, and all. I know you also can be wondering, as a HIV positive person, can I live a normal life? Yes, you can. This therapy also helps you to get a partner. Whereby when you take your medication steady as prescribed by the doctor, you are able to have a partner and you won't transmit this disease to your partner. I know you also will be wondering, as a woman who is tested positive, can I also carry on with my life? Yes, you can. You can be a mother. Whereby as a woman who has a baby in utero, when you take your medication regularly, it's going to protect the child from being affected. As a woman who also has a baby and is going to be breastfeeding, it's going to protect your child from this infection once you're taking your medication as prescribed by the doctor. So you see why I say you can live a normal life. Thank you.
Thank you so much, Nurse Princess, for that wonderful contribution on the treatment of this HIV and AIDS. So, in conclusion, I would say that this HIV and AIDS have become one of the major pandemic threats in public health setting, especially those that are living in low and middle income countries where access to prevention, treatment, and medical care services are being limited. It is mostly severe in Southern Africa. I want to plead with those people that are already positive of this HIV and AIDS not to give up yet. There is still life after HIV and AIDS. And HIV and AIDS is mainly a disease that can be controlled with medications. So don't let it monopolize your life. Be living a healthy life by taking your drugs, don't skip your meals, and also keep appointments with your healthcare provider. Thank you for watching us. Thank you for your active participation. And please do well by subscribing and commenting and liking all our social media platforms known as Optimal Healthcast, aka As the Health for Africa. Thank you, everybody, and bye for now.
Thank you.